Hello again. This is Janet Michael, your insurance agent with Benefits Redesigned. And I wanted to walk you through the plans that you have to choose from. And we're just going to touch on a few of the highlights of each of the plans. So this is the Select 7500 plan. It is a 7500 per person deductible with a 1500 maximum per family. So if you watched my video on deductibles, you would know that 15,000 would be the maximum deductible that your family would pay. This also does not have any non-participating providers included. All preventative care is included within this plan, and you have an out-of-pocket maximum of $7,900 a person. So once you hit $7,500 in your deductible, you only have another $400 to go until you've paid 100% of the plan. It does have copays, $40 copays per visit. You can see if I can get my highlighter working there. There we go. And deductible does not apply. Specialists are $70 a copay visit. Deductible does not apply. But notice here on labs and on imaging, the deductible does apply first. So keep that in mind when comparing that to other plans. Your generic drugs are $4. And your surgeon fees and your facility fees for like an outpatient surgery, emergency room, and EMS all have deductibles applying first. So it's important that you realize that the deductible will come first on any of those particular needs. Urgent care is a $70 copay. Deductible does not apply, but deductible also applies for any hospital stay at the facility or the surgeon fees, anything related to that. Now, outpatient services, when it comes to office visits, you do have a $40 copay and deductible does not apply. Inpatient services, you have a deductible that applies first and then no charge after that. That's the 7,500. So let's talk about the HSA plan. In the HSA plan, you have a $6,350 deductible. And because this is an HSA plan, you will have, whoa, let's back up here. Sorry about that. You will have no copays until you have hit that deductible. And once you've hit that deductible, you have also hit your maximum out of pocket. You can see that right there. So one thing to remember on an HSA plan, your preventative care is not subject to the deductible. So you can get your mammogram or colonoscopy and annual screenings done and not be subject to the deductible. The deductible also does not apply to generic preferred brands or non-preferred brand prescription drugs. Let's look at the other HMO. This is the 3,100 HMO. It has a $3,000 per person deductible with a $6,000 family. So again, you have two people, let's say you have 4 people in the family. Once 2 of you hit your deductible, then the whole family is covered at that point. Preventative, of course, 100% coverage. You do have $6,850 a person for participating providers. There is no out-of-pocket limit for non-participating providers. There is no deductible for non-participating providers because basically there's no coverage for non-participating providers in an HMO plan. You have a $35 copay for a doctor's visit and deductible does not apply. $70 copay for deductible, and again, the deductible copay for specialist and deductible does not apply. Lab, deductible applies first. Here's your prescriptions, $4, and deductible does not apply. Emergency room care, you have a $400 copay and the deductible does not apply. Outpatient surgery, deductibles apply first. just as we saw in the other HMO plan. Hospital stay deductibles apply first. And then outpatient services for mental health, you have those charges in here. So people often ask me, how do I decide whether I want to pay more for a lower deductible? Well, it really is going to be based on how much you're going to use the plan, which plan is the better option for you. And speaking of how much you're going to use the plan, let's look at this PPO plan. This PPO has a broader network even than does the HMO. It includes things like MD Anderson and Texas Children's, which the HMO does not directly connect to. It has a $3,000 a person for participating providers and a $6,000 per person deductible for non-participating providers. So let's say you wanted to have a treatment done in California and you're here in Texas. That would probably be a non-participating provider, so you would have that $6,000 deductible to meet, even if you'd already met your $3,000 deductible for in-network. Preventative services, of course, are always covered, but keep in mind, though, preventative services still need to be in-network. That is important. What about out-of-pocket network maximums? It's $6,200 if you're in network, $15,000 if you're using non-participating or out-of-network doctors. Copay are the lowest of all the plans we have, and it's a $5 copay for a doctor, a $10 copay for a specialist, and diagnostic tests are 50% co-insurance. The deductible applies first. So you would pay that deductible and then 50% of the cost up to your maximum out of pocket. Same is true with your imaging, CAT scans, that type of thing. Generic drugs, $4 again. Emergency room services, your deductible applies first, then 50% of the cost for co-insurance up to your maximum out of pocket, as is facilities and surgeon fees. The same thing goes here. And that is true whether you're in or out of network, by the way. Emergency deductible applies first. Urgent care is a $10 copay. So whenever you can use our urgent care over emergency room, highly recommend it. Your facility fees for hospitals are going to be 50% after you meet the deductible. So that's just a quick run through of these 4 plans that you get to choose from. If you have any questions or you're not sure you understand something, please feel free to reach out to us. You can email us at contact@benefitsredesign.com, or you can call the office and talk to Carol at 281-377-5125. Thanks so much. Bye.